I'm often asked if all pathologists do autopsies and whether that's what we do all day, and no, absolutely not. So autopsies are done by a special type of pathologist called histopathologists, and that's what I do. But even histopathologists, not all of us do post-mortems, and those of us who do, it's a relatively small part of our work. So I spend maybe 2 or 3 hours a week doing post-mortems, and the rest of the time is devoted to looking down the microscope and making diagnoses for the living, things like cancer or infections. Histopathologists are one of 20 different pathology specialties. The others include haematology, the study of the blood, microbiology, looking at infective organisms like bacteria and viruses, clinical biochemistry, which measures the levels of chemicals in the blood, which can tell how your organs are functioning. And there are many other different specialties, including immunology, toxicology, genetics. There's a really wide and varied range of different medical and scientific specialties that make up pathology. So histopathology and autopsy pathology is only really a small part of that. How did I feel when I did my first autopsy? Well, I think it was a mixture of nervousness and excitement, because I was keen. I was starting my journey as a pathologist, and I was very interested to find out and learn exactly what it involved and how to carry out a post-mortem. I'm often asked if I was put off by being in the same room as a dead body, but it's important to remember you don't do this on your first day at medical school when you're 18. You build up to this throughout your career. So as a medical student, I spent 6 years studying anatomy, so we would dissect a dead body to find out about what normal anatomy looked like. When I was a junior doctor, I would assist in the operating theatre. So I would be there with the surgeons and I would help, perhaps holding a retractor to hold the skin out of the way. So by the time I got to do a post-mortem, I'd had a lot of experience of seeing the human body, both dead and alive, and it was really a combination of all of those things that helped me understand what it was I was doing. I'm often asked if it's possible to donate your organs after an autopsy. Well, for most organs, that's not the case. You need the heart to be beating to keep those organs alive so that they don't start to deteriorate. So if you want to donate the heart, the kidneys, the lungs, for example, they need to be removed from somebody who is brain dead with no possible hope of recovery, but the heart is still beating. So obviously if you have an autopsy, that's not the case. They're only done once you're absolutely dead and the heart stopped beating. But I have done some autopsies on people who have had their organs removed prior to death. They would only be removed if the cause of death was not relating to that organ that's been removed. So for example, if somebody had a severe head injury, then it would still be okay to donate the heart or the lungs, for example. But you wouldn't be able to donate anything relating to the head. There are some tissue types that can be donated after the heart has stopped beating. And that would be things like bone, which can be used as a bone graft if somebody's had a really nasty fracture, the cornea of the eye, and also the heart valves. So they can be removed after the heart stopped beating, but ideally we like them to be removed before the post-mortem starts because we need them to be as clean and sterile as possible. We don't always find a cause of death at an autopsy. We try our hardest, and as well as the standard examination of the body, there are extra tests that we can do if the cause of death is not clear. So for example, we might take a piece of tissue to look at under the microscope, or it may be that somebody has an infection, in which case we might take a swab and send it to microbiology. That's another part of the pathology lab, and the experts there will be able to grow and identify any organisms that have caused an infection. But there are about 5% of deaths where we can't find a definite cause. And that may be because there's nothing to see or measure. For example, the heart and the brain have a lot of electrical activity. That's what helps them work. And if something goes wrong with that electrical activity, there's nothing to physically see, but it could stop your brain or the heart working. So if somebody has an epileptic fit, for example, we can't necessarily see the changes in the brain, although we may be able to see previous damage from previous fits. So in those cases where we haven't got a definite cause of death, we put together all the different pieces of the jigsaw. We want to know about the history of the patient, what illnesses have they had in the past, what are the circumstances around their death? Did they suddenly collapse? Were they found dead in bed? Exactly what happened to them? And then put that together with the findings and the findings of all the different tests to come to the best conclusion that we can about the likely cause of death.